and get started. Thank you for being on today's report. Again, the most important thing for me is that I make sure that every single patient that comes into my office learns the information that they need to know in order to succeed in moving forward. Just a couple of things that I want to mention. If you have any questions throughout today's report, go ahead and feel free to chat and ask me any questions that you have. If I can't get to it today, I promise I will respond via email as soon as possible. So I just want to put that out there. Also, please, if I do any kind of polling or if there are any questions, please feel free to participate. Just kind of gives me a little idea on feedback. So again, thank you for being on today's report. This is super important that everybody attends and everybody listens to this. I'm doing this for 3 reasons. One is that it's more convenient for you. Obviously, having to schedule specific times for you to come into my office can be somewhat of a nuisance for some people depending on their work schedule. 2, if you come to a talk and I give you some information, you're going to maybe absorb about half of it. And so using this format, you're able to go back and actually re-listen to all the information and gather some of that if you didn't understand it the first time. And then number 3, the most important thing for me is that I don't ever just want to be any other doctor. It was never my intention for somebody to walk into my office, tell me what they're feeling or what they're complaining about, and then I tell you, go do this, go do that, and you're going to get better. It just doesn't work that way. In fact, what most people need in this country is education and understanding of how their body works. The more that we understand how our body works, we begin to take better care of ourselves. And it blows my mind how little people really know when it comes to spine care. And so there's a lot of things that we need to cover, a lot of things that we're going to talk about, some things that I'm going to go over tonight that you may not agree with, and I'm going to tell you that's okay. Everything that I say is backed by the literature. All of my opinions and all of my facts are backed off of scientific data. So if you have a question about something, please feel free to ask me, and I'd love to start that conversation off with you. So let's go ahead and get started. Starting off, I always like to ask my patients, what is health? Because most people, that's what they want, right? You want to feel good. When you grow older, you don't want to break down. You don't want to be hocked up on 5, 6, 7, 15 different medications, which is very common now. When you're older, you don't want to find yourself in a nursing home. I'm pretty sure there's never somebody that ever says that they want that. So if you want to avoid those things and you want to have a life full of energy and vitality and you want to function the way you function when you're a teenager or when you're younger the rest of your life, well then obviously health should be a concern. The problem is that most people don't know what health is. So if I were to ask you guys tonight, if I were to say, what is health? What do you base your health on? How do you know whether you're healthy? What do you think the most common answer is to that? And I'll give you, just a couple of moments to think about it. What is it that you determine your level of health? I know what the answer is. The most common answer is because I feel good. The second most common answer is because I look good. So the fact of the matter is that we base our health on how we look or how we feel. And if that's the case, then these two people are very healthy. And I use these two people as examples because at this point in their life, if I were to ask you guys, looking at them there, do they look healthy? Certainly you're gonna nod in your head and you're gonna say, yep, they do look healthy. Now here's the thing. We know that both of these individuals died of cancer. Now this is what I also know about cancer, is that it takes about 30 to 35 years to develop. So at this point in their life, when they looked really good, they felt really good, I know that both of them had personal trainers. They both had personal chefs. They both had money in the bank to be able to afford the best insurance, the best medical care that they could ever get. But yet at the end of the day, they ended up developing cancer and dying from it. So if health, again, is based on how we look or how we feel, obviously we're not headed in the right direction, because both these individuals, that's what happened. And I use these two people because they're celebrities and most people know them. But there are millions more every single day, our friends, our family members, that are literally dying and they don't realize that they are. And so I call it the walking dead. In other words, there's people out there that are walking around headed for catastrophe and they don't realize it because they're basing their health on how they look or how they feel. How many people every single day die of a heart attack and yesterday they didn't know they had a problem, right? And you hear about this all the time. Or how many people get told that they have cancer, yet they don't feel it. They don't feel bad, right? So just because you feel good, again, doesn't mean you're healthy. And this is something that we really have to begin to understand. The same way that you start to hurt with a headache, or you got neck pain or back pain, that doesn't mean that you're sick. But at the same time, it's a check engine light. It's telling you that you got to get something checked out and you got to go from there. So getting into this, I want to cover three important conditions or three important reasons why Americans are dying at alarming rates today. And as a chiropractor, obviously I'm concerned with your spine, right? And my philosophy to health is you got to move right, you got to eat right, and then you got to think right. And here's the thing, is that part of moving well is having a healthy spine. So it is impossible. You could exercise 10 hours a day. You could eat all the organic food you want. You could practice all the happy thoughts and positive thinking and mental exercises that you could practice in a day. And if your spine is not functioning at 100%, hopefully by the end of this talk, you're going to understand why you will never achieve maximal health. So part of health is having a healthy spine. That is such a crucial, important step. But your spine is what's not killing you today. In other words, my patients are not dying today because of their spines. It accelerates the death rate, but this is not the main reason why they're dying. The main reason is because of heart disease, diabetes, cancer, prescription medications. So when we talk about heart disease, it kills 500,000 people every year. Now, does anybody today know what the #1 selling drug is of all time? And I ask this because, again, most people, they don't know, but usually people are going to say something like for cholesterol or blood pressure. Lipitor is the blockbuster selling drug of all time. It's the most sold drug than anywhere on this planet. Yet, heart disease still kills 500,000 people every year. So here's the crazy thing, is that if Lipitor is doing its job, shouldn't we see less people dying of heart disease? In fact, every year for the last 20 or 30 years, we've had more prescriptions filled for heart disease, for cholesterol, for blood pressure, for stroke prevention. We have more of all that, but yet we're still dying at alarming rates. So obviously that doesn't make sense. And that's one of the big things for me, is when I just take a step back and look at it. You know, when I went to Merck, or I worked for Merck Pharmaceuticals for a while. And what I saw was that every year we had more doctors, we had more nurses, we pumped more money into research, we developed more drugs, we came up with more procedures, we had more technology, we had more of everything. And the question, a very important question, is have we gotten healthier because of it? And the answer is no. We actually rank as a country very low on the healthcare spectrum. Out of the whole world, 5% of the whole world lives here in the US, yet we consume 65% of the world's medications. So if drugs, again, are doing their job and they're making us healthy, should we not be some of the healthiest people on the planet? And obviously we're not. And so again, there's a problem there. Another big killer in this country is cancer. And this is something that almost everybody has a fear of, because it's in everyone's family. In other words, everybody's dying of heart disease, everybody's dying of cancer, and the problem is that you don't have to. Cancer kills 700,000 people every year. And some of you may recall this, but in the 70s, Richard Nixon waged war against cancer and basically said, what do you guys need in order to beat cancer? He asked all the scientists, all the organizations of the world, said, what do we need in order to beat this thing? And they said, we need $1 billion. So $1 billion was appropriated, and you would expect that we would make a dent, right, in cancer. Obviously, it didn't happen. In fact, some things have gotten worse, and as time has gone on, even our children are developing cancer at alarming rates. So obviously, we're missing the boat here, and we're not approaching health from the point that we should. Here's a shocker, and when I always bring this up, people are just floored by it. And this, again, is based off of peer-reviewed medical journals. So in other words, this is information that I took from the Journal of American Medical Association, the British Medical Journal. Dr. Barbara Starfield, who was a Johns Hopkins researcher, so pretty smart woman, the last study that I read was published in 2010. And what they found was that the leading cause of death in this country is actually prescription drugs and medical procedures, which is just crazy. It's mind-blowing. They estimate that it's close to 1 million people every year that are dying because of prescription drugs and medical procedures. And again, for the prescription drugs, this is not people that are abusing it. These are people that are given a drug. It's the right drug for the right diagnosis, and they're taking it the way they should be taking it. So this is not including all the pill poppers and the abusers. As far as medical procedures, it's not the actual procedure that's killing people, but it's all the complications that are associated with that procedures. In other words, getting an infection in the hospital because of a procedure, or not being able to move around like you did before. In other words, spine surgery, and then you're not functional like you should have been, or you have a hip replacement or a knee replacement and you're not as functional as you should be, and so that contributes to an early mortality. So pretty scary things. Now, when you look at all this together, when in this country, when you get diagnosed with heart disease or you get diagnosed with cancer, what's the first thing you want to do? You want to go to your doctor, and what's the first thing that they're going to put you on? They're going to give you some prescription drug or some medical procedure. So the other two leading causes of death what we try to treat that with is actually the #1 cause of death, which again, it just doesn't make sense. And so obviously when you take a step back and you look at these things, what are your options as a patient when it comes to taking care of your body? You can wait till you have some kind of symptom or some kind of devastation and then participate in a healthcare system that's actually not even working to get us better. Or you can learn how to take care of your body and prevent this altogether. And that's really what I'm trying to get you to understand, is that we're all about prevention. We're all about enhancing your health, not fighting your body. Your body was designed to go 80 to 120 years of good health. That is a fact, a scientific fact, that your body should literally your body should go to the point to where you just all of a sudden die, not because you developed cancer or heart disease, but you just eventually run out. That's it. And that's how it should be going. Now, when I think of health, and I ask this question all the time, what is health? This is the picture of health to me. In other words, I want you to focus on the part where you see up at the top. I want you to focus here. What controls your whole body? And obviously here where you see me moving the cursor around, it's your brain. Okay, so you can live without your heart. We can take your heart out, you can replace it, and you can continue living. You can lose a kidney, you can lose parts of your intestines, you can lose parts of your livers, and you'll still continue to be healthy. You cannot do that, or you'll still continue to live. You cannot do that without your brain. In other words, as soon as you take your brain out, lights out, right? Your brain is what controls all function in your body. And if we're to talk about health, where does health and healing come from? If you've got a bad kidney or a bad muscle cell, what has to tell those organs in order to start functioning better? What has to coordinate all the enzymes and the proteins and all the chemical reactions in order to start to rebuild and make you healthy again? Your brain is what controls all that. So if we talk about health, this is the perfect picture of health, meaning you have a brain that sends signals down your spinal cord, out through all the nerves that then come and connect to the rest of your body, and that's how you determine whether you're healthy, is the ability for your brain to actually communicate with your entire body. Now, sometimes I ask people, what controls your whole body? And people are going to tell me your spine, and it's because a chiropractor is asking you that. Your spine is important, but it's not as important as your brain is. So I'm going to tell you that as your doctor, I am 100% concerned with your brain's ability to communicate with the rest of your body. So this is an important thing to understand. If your spine is not healthy, it is going to decrease the quality of communication between the brain and the body, and that's where you start to run into problems. So here's the thing. You're not going to come into my office and say, hey Dan, my pancreas doesn't feel so hot today. All you're going to say is that you hurt, and basically those nerves around that part of your body that hurts, they're going to be sending you pain signals, but there's so much more that's going on. And if your spine is not healthy, it makes it pretty much impossible for the rest of your body to be healthy or to be functioning the way it needs to function. So when we talk about normal, healthy function of your body, I want you to look at it from this point of view. We talk a lot about posture and mobility and the position that your spine is in. If you were to look at posture, you want to make sure that your head is centered over the rest of your body, that your hips are neutral between your legs. In other words, your spine is not shifting in one direction versus the other. When we take your x-rays, same thing. We want to see that things are pretty much straight up and down. And that's pretty easy to understand. When you look at somebody from the front, you should see that everything is straight up and down. So again, that's pretty easy to understand. It gets a little bit more complicated when we actually look at your spine from the side. Now, there is some pretty sophisticated math that went into modeling the ideal spine. So thousands of people that were studied and analyzed, and what we did was we determined as a profession, what is the ideal position that your spine should be in? So just like cardiologists know proper blood pressure, or they know what your cholesterols or your triglycerides should look like, just like a dentist understands alignment of your teeth, a chiropractor understands the optimal position that your spine should be in, so that way you can maintain a normal state of health for your spine the rest of your life. From the side, you want to see that there are actually 3 curves in your spine, one in your neck, one in your mid-back, and then another in your low back. So when we take your x-rays in our office, the 2 most important pictures that we can really evaluate are going to be your neck from the side and then your low back from the side. So these are 2 important things that we want to pay attention to. Now, here's an important thing to understand. This was published in a journal, Bone Joint Surgical American Journal. This was in 1981 that they determined this. They determined that loss of the curve in the neck or anywhere in the spine resulted in an increase in mortality of up to 15 years. So basically, as you lose these normal healthy curves in your spine, you can lose up to 15 years off your lifespan. Pretty crazy, right? Pretty remarkable. Now, I'm going to show you a couple of examples of x-rays because, again, I want you to understand when you get your report, your physical report that's going to have all your x-rays and all your pictures, I want you to understand what you're looking at. So here's an example of an abnormal x-ray. And this is actually a patient of mine. His name is Bobby. He's a professional golfer in the area. And to be honest, when he came to me, he had no symptoms. In other words, he walked into my doors, he said, I'm a golfer, heard chiropractic could help with golf, that's why I'm here. And I told him, okay, let's go ahead and check your spine out. Just like every patient that walks into our office, we want to go ahead and do a spine exam. Most people don't realize this, but you should actually have a spine exam once every 3 years. Just like you should get your eyes checked, your teeth checked, your blood pressure checked. You know, these are things that you do for good measure. Same thing with your spine. You don't want to wait till you have pain and then you get it checked. And so, of course, like most people, Bobby had never had his spine checked. We decided to go ahead and do it, so we took his pictures, and this is what we see. Now, if you notice, there is no curvature in his neck. So this is what we call a straight neck or loss of the curve. Now, I told Bobby, I know you don't have any headaches, and you don't have any neck pain, everything looks, or you feel fine, but when you look at your x-rays, you're sick. In other words, this is completely abnormal. And this would be like you feeling great or feeling good, and you go to the doctor, and the doctor says, whoa, your blood pressure's off the charts, something's not right. And so, of course, I talked to Bobby about this, and he decided to get this fixed. This is him 3 months later. So when I talk about correction, the things that we want to pay attention to are the curvature that you're supposed to see in your neck. This is a normal, healthy curve. And like a spring, it'll absorb energy in a much better fashion than something that's just straight up and down. In other words, here, this is a spine that's deteriorating and degenerating at a much faster rate because gravity is just compressing down. So on a long enough timeline, this would have actually deteriorated and broken down much faster than what Bobby's neck should have broken down to. But of course, you can see him here. This is 3 months later. This is a normal, healthy x-ray, and things are looking much better. Another thing that we pay attention to is the actual disc spaces in between. Now, these disc spaces, they're 88% water, which is the main reason why I always talk about hydration. In other words, you could come in and I could adjust you and we could be doing all these things, but if you're not properly hydrated, then you're not getting the full benefit of the adjustment, and you're actually never going to be truly healthy until you hydrate your body properly. Here's an example of what you should look like from the front. So again, you want to see that the spine is straight up and down. In other words, this is a normal, healthy x-ray. This is actually an x-ray of a 10-year-old child. His name was Matthew. And this was his post x-ray. And if you look at Matthew's x-ray before, you can see how off his spine really was when he started care. So pay attention here. You can see where it actually curves off to one side. Now, the interesting thing about Matthew is that he had asthma when he started our office. If you were to look at this area right in through here, where this kink is, the nerves that exit this part of the spine actually go and connect to the lungs, which is pretty interesting because when Matthew started with us, again, he had this abnormal curvature. He obviously had a little bit of stiffness and pain, but more importantly, they sent him to us because of his scoliosis combined with asthma. And asthma, and if you know anything about scoliosis and asthma, they will complicate each other. So as you get worse curvature, you're actually going to start to compress the lungs more, and it becomes an issue. So we decided to start working on Matthew, and he stuck to our plan, and this was him 18 months later. And the pretty interesting thing is that on this x-ray here, Matthew had no signs of asthma, which is awesome. He was on steroid shots twice a month. He was on a breathing and or a nebulizer every night. He was wearing this brace that was trying to force his spine back into a better position. He wore it 23 hours out of 24, which is just amazing when you look at him here, completely different kiddo, and obviously free of asthma. Now, what I will say is that not everybody experiences these results. In other words, I have patients who have spines that are straight up and down, and they still have asthma. Well, obviously it's not their spine. So here's the thing. My heart goes out to kiddos and adults who are out there that have a problem, and if they get their spine checked and worked on, there's a potential that they could actually have improvement. But you'll never know unless you actually get it checked. So very important that you have your spines examined. Now, here's an x-ray of the low back. So what you're seeing here is on one side, you'll see a pelvis or the hip bone right here, and then you'll see the other hip bone on the other side. Now, these two bones should actually be even, kind of like you see here, where you can see that they're both level. And this is the same person. This is when they started care, And this is the same person 60 visits later. Now, the important thing to understand with this patient is that when she started with me, she was actually getting ready to undergo dialysis because her kidneys were so dysfunctional. Now, if you know anything about dialysis, it is super expensive. And this female, this patient of mine, she didn't share this with me until her 60th visit, but she told me that prior to her starting her chiropractic care, she was already scheduled to do dialysis. She started having so much pain that she wanted to come and see me before she started that. So we started her under care. She started feeling better and better to the point to where she does not need dialysis anymore. And what's crazy is that she would have spent around $15,000 when we look back at when she started care to the point to where she was today in our office. And I bring this up because a lot of times people talk to me about cost. They say like, oh, it costs a lot of money to take care of my spine. That is not true. It costs you money to get sick. It costs money to get diabetes. It costs you money to get heart disease. It costs you money when you get cancer or when you have to get dialysis. It's an investment in your health when you decide to take action and prevent these things from happening. And that's exactly what we see happening to our patients, is we're able to take them from a point to where they were headed towards devastation, and we actually build their bodies up to make them much more functional. And in the end, they're not going to be spending all the money that people usually spend when it comes to healthcare, which is just amazing. One of the most important things that people ask me is, can I help? Well, to answer that question, it comes down to you. Okay, if your spine is something that can be corrected, and you're going to know that from the report, in other words, after we analyze your x-rays, I'm going to tell you whether or not it's something that can be worked on and improved. But the success of your spine and the care that you receive in my office is not because of me. And this is important. So whether or not I can help you really comes down to you. Are you willing to take all the steps and all the action necessary in order to get yourself better? And here's something that I share with all my patients, is that when you get better, and this happens all the time, people say, thank you so much, Dr. Gonzalez, thank you so much, Dr. Daniel, for helping me feel better or helping me to get healthy. And I'm going to tell you, oh, no, it's not me, it's you. And I say this because when you get better, it's because you made the decision to make yourself better. However, when you don't get better, it's not my fault. Okay, and that's because you didn't take action. In this country, we have so much knowledge, and in the Bible it talks about how my people suffer for lack of knowledge. No, we have so much knowledge. We have more knowledge than ever before. More books on health, more books on fitness. We have more fitness gyms. We have more diets than ever before. What we have is lack of action. So it's not lack of knowledge, it's lack of action. And if you don't put forth the action, then we have a problem. And that's very important. And I don't want you to start here or become a patient here if you're not willing to take the steps necessary in order to get a hold of your health. The other question that people ask me is, how long is it going to take? They did studies on spine care, and they took people at different stages of spine disease, and what they found was that they adjusted people once a week, twice a week, 3 times a week. They went all the way up to 7 days a week for 3 years at different stages of spine health, and they found that on average it took 1 year to get people to where they needed to be in terms of correction. But this is kind of like braces. So in other words, some people, when they get braces, it can be 1 year of care. Some people, it can be 4 years. It really just depends on the individual. Now, in terms of frequency, what they found was that people adjusted 4, 5, 6, or 7 times a week did no better in terms of correction than those adjusted 3 times a week. So the absolute maximum frequency that I ever recommend in my office is 3 times a week. Those people that were adjusted twice a week experienced a 40% improvement. Those people adjusted once a week, while they felt better and reported a higher quality of life, they didn't see any spine correction. And the way you have to look at that is, I could tell you to do sit-ups once a week. I could tell you to do sit-ups 3 times a week. The people, obviously, that are doing sit-ups 3 times a week are going to get more benefit and improvement than those doing once, right? So your body requires repetition and consistency, and that's what's important to understand. And here's another thing, is that the most common thing I hear about chiropractic is permanency. In other words, I could adjust you today, 2 to 3 days later, studies have shown that your body, even though we adjusted you today, 2 to 3 days later, it goes right back. And that's just like anything. In other words, today you brushed your teeth. Tomorrow you're going to have to brush your teeth again. And the next day you're going to have to brush your teeth again. Today, if you eat healthy food to get the benefit, tomorrow you're going to have to do the same thing. And the same goes for chiropractic. Now, I won't have to adjust you at the same frequency forever, but just like when you get fit and healthy at the gym, if you were to stop going to the gym, obviously you would have problems and you wouldn't stay at that level of health. The same thing with chiropractic care. Or if you get all your cavities fixed, you go to the dentist and you get all your cavities fixed, that doesn't mean that you stop brushing your teeth. These are all things that you have to continue to do for the rest of your life if you want to stay healthy. Here's another thing that people ask me is how much does it cost? Well, of course, you submitted your insurance information if you have it to Lauren or Brandy. They will both let you know specifically or individually what your care plan will entail based on your benefits. But here's the thing. If you don't have insurance, I guarantee you that cost will not be the reason why you don't move forward with care. And like I said, it's not costing you anything. This is an investment. So if you care about your health, I want you to put forth the effort to do that. I will meet you in the middle. In other words, if you cannot afford our private care plans or your insurance, you have a problem with that, if you have a big deductible, you need to talk to us. And I'm willing to help you if you're committed and serious to helping yourself. It won't be free, because I've done that before, and free, there's no exchange of value, and people just take advantage of that. So I'm not going to do this free. Now I'm telling you, I am successful with or without a new patient. I have many new patients. I don't need another new patient. I am here for you. So if this is something that you really want to do, you need to commit to that. And again, if you have an issue with cost, and you need to bring that up, and we need to have a conversation so that way we can help you out. This last slide I want to talk about, this is important to me. The catch-all of this is that if your spine is not healthy, it makes it impossible for your nervous system to be healthy. If you have a weak nervous system, your body's never going to function the way you need it to function. Here's an example of a patient that I saw in my office, who she walked into my office and she said she was seeing a chiropractor for 22 years. Now, if you look at this spine, you'll see that it doesn't look like she was seeing a chiropractor for 22 years. In fact, there's multiple spots that are deteriorated. If you just look right into here, lots of areas that are degenerated and undergoing decay, even though she said she was seeing a chiropractor for 22 years. Now, here's the thing. She came into my office. She said she had been to a chiropractor for 22 years. I took her x-rays. This is what we see. Of course, I call her doctor up and I say, okay, what was the treatment plan? The problem is that there was no treatment plan. She was going to the doctor. She would get headaches. He would adjust her, and he'd tell her, come back when your headaches come back. And I've heard this time and time again. That's just like treating a symptom. So here's the thing. I never want any of my patients, years, 20, 30, 40 years from now, to walk into someone else's office and their spines are just completely obliterated and deteriorated. That's embarrassing. That tells me that that person wasn't getting the care that they needed. So you're not going to come here just because you're hurt, because you have a headache or because you have neck pain. I want you to be a patient here because you want to make sure that your spine does not deteriorate, and that's going to make sure that you have a chance at being healthy well into your later years, which is something that we all want. And again, the reason why I do this, the reason why I get adjusted weekly and I make sure I see my chiropractor, it's not just for me. It's because I love my wife, I love my kids. I'm going to be the first person in my generation, in my family, that's going to be able to play around with my great-grandkids. And I'm telling you that I will be able to do that because of the decisions that I make every single day. And so again, that's something that I take to heart, and it's something that I want you to understand, is that your spine is so much more to do with how your body functions than just having neck pain or headaches or back pain. And so when you start to receive the benefits of chiropractic care, you will start to experience things like sleeping better. You're going to have more energy. But most important, we're lengthening your lifespan because we're making sure that that system, the nervous system, is functioning at 100%.